Hey guys, Dr. Rodman here. So this is for if anybody failed the mobility test for the ankle. So that was a test when we had our foot on the floor in a lunge position. We were leaning forward and we're making sure that our knee clears our toes by about 2 inches and our heel is not raising up off the ground like that. Or if you have any pain in the back or front of the foot, this is for you, this mobility prescription. So the first thing you want to do is get your foam roller, put it on the floor, and you're going to get that calf on there. The back of the leg right here. Cross that leg over to get a little bit more pressure. You're going to kind of roll back and forth to scan for lumpy, bumpy, sore spots. And when you find one, you're going to kind of hold out on that spot, camp out on there. Going to go up and down for 20 seconds, side to side for 20 seconds. And then you're going to pin the muscle and stretch it. So pointing that foot down, then back up for a total of about 2 minutes. That should really loosen that area up. The next one you're going to do is just stretching the front of the leg here, because this is kind of an understretched muscle. This is an easy one you can do kind of during your day. I'm actually doing it right now and you didn't even know it. Just pointing my foot down and you're just kind of rolling the inside and the out, stretching kind of that tibialis anterior type area here. And that one right there is usually good for about a minute or two. And then what you're going to do is, as we talked about, we use our bands here to really stretch the joint. So what we want to do is get this right on top of the ankle joint. This is one of the best mobility stretches for the ankle. A lot of times it's the joint that gets a little bit stiff and stuck. So you have your band lowest part, you wrap it around a rig or anything like that, and you're going to go ahead and lean forward while the band is in that ankle joint right there. And you're just going to kind of get into a comfortable position. You can kind of push your foot in and out. You can even get on your knee and kneel. This is probably a little more comfortable to do it this way. And you just want to find those areas that feel like they're stiff and tight. So I kind of plant my foot down so the heel doesn't come up with my hand. And I push that knee out, really trying to clear out that range of motion. Open up the lateral ankle here. And do this for about 2 minutes too. And you can see a nice difference in range of motion just by doing that when you're done. So that right there, then we have another one. And this one I like, you could do this at any time at work, as long as no one's looking at your feet. Get a lacrosse ball. I feel like we should leave work feeling better than when we got there. We should have more mobility than when we got there. So we've got to start doing things to be productive with mobility at work. So take a ball like this or a tennis ball, and we want to work the bottom of the foot, the plantar fascia, because a lot of times this gets really stiff and tight from maybe wearing too many sandals or flat shoes or not having a good arch support. And it gets really stretched and sometimes too tight. So this is a good way to kind of work it. So you put the ball on the bottom of the foot. You can push down gently on the top of your knee if you want a little bit more pressure, like that right there. And you're just going to kind of roll your foot up and down. And then same thing, side to side, if you find a lumpy, bumpy, sore spot. And same thing, for about 2 minutes you're going to do this one. So that's your mobility prescription for your ankle.